When it comes to infectious disease, there is great variation of predisposing causes from one place to another. These differences are due to environmental factors, which include climate, cultural factors, availability of healthcare, and the dietary habits of a population. Treponema pallidum tends to be more present in warmer and tropical climates. Hence, this warm climate has made it possible for bacteria to thrive, and accordingly, it is not surprising that the highest rates occur in southern states. It has been observed that cold climates can cause syphilis to be more severe, while unsanitary conditions and herding together can promote further spread of the disease. The southern parts of the United States also have higher percentage of disadvantaged minorities who lack health insurance, access to health care, educational programs, and face unemployment, racism, and poverty. These factors facilitate the contagion of syphilis, disproportionately affecting African Americans. Your lack of good nutrition tends to affect those with syphilis more aggressively as well. Other factors include income gaps between white and black households. For example, in the city of Jackson, Mississippi, 23% of the residents are below poverty level. 91% of this number are black. For white families, the household income is $41,636, while the number is $18,316 for black families. Accordingly, the educational achievement in Jackson is below the averages of other cities. In the states of the Bible Belt, about 15.1% of the population have a high school education or less. Families in these areas are mostly comprised of unmarried women, up to 33%. Large urban geographic locations also have a greater concentration of syphilis cases. For example, the large cities such as Los Angeles, Chicago, San Francisco, New York, and Seattle. Particularly, men who have sex with men have been most affected with noticeable increase in syphilis. In the 1990s, a plan was implemented to eradicate syphilis. In this decade, syphilis was more common in the heterosexual population. By the year 2000, there were only 600 cases, but by 2013, there were 9,000 cases in which 91% were men. Men who have sex with men compose 60% of this number, the majority who also carry HIV. This demographic shift shows that the new AIDS therapies that provide and prolong a quality life have given gay men the illusion that it is safer to engage in risky sexual behavior. As a result, educational efforts have been less effective. As better retroviral drugs are available, syphilis cases rise. Interestingly, syphilis cycles are either heightened or reduced by the collective actions of rational individuals. Cycles die out rapidly when individuals have less sex partners, and these individuals serve to dampen cyclical fluctuations of syphilis. In the homosexual community, the alarming rise in syphilis demonstrates the low number of these curbing factors. The CDC has called the prevalence of this STD among the gay community as an epidemic. Syphilis epidemics have an 8 to 11 year period that follows the natural dynamics of this infection. These cycles may provide windows of opportunity to minimize or eradicate the disease as it once was thought to be possible.